We always start off with statistics, and according to Johns Hopkins University, authorities in 213 countries and territories have reported more than 3,813,000 coronavirus cases worldwide since China first reported its first case to the World Health Organization in December. Over 267,200 confirmed deaths from coronavirus. Approximately 1.26 million people have recovered in the United States as of today. More than 1,244,100 people have been diagnosed with coronavirus, and more than 74,840 people have died. Now, there's a lot of, we don't know what's going on with coronavirus, but I will tell you 10 truths about coronavirus that are basically, you can't really argue with it. Okay. And these truths come directly from the former Centers for Disease Control Director, Tom Frieden. So let's break down some truths about coronavirus. It's really bad. Coronavirus is bad. It's not a good thing. And it's really, really bad in New York City. Even now, with deaths decreasing substantially, there are twice as many deaths from coronavirus in New York City on a usual day than anything else combined. New York has more confirmed coronavirus cases than any state in the country, with 321,000 cases and more than 25,000 deaths. In New York City alone, there's more than 173,000 cases, with 43,000 hospitalized and close to 14,000 confirmed deaths. They're at 13,938 confirmed deaths. Here's another truth. It's just the beginning. We're not at the end of coronavirus, no matter what Donald Trump says. We are just at the beginning. And here's another truth. Data is the only truth that we can follow. Data can be used to monitor trends. It can help to stop clusters. It can turn outbreaks from getting serious. And the more data we have, the more likely it is that we're able to stop coronavirus in its track. And here's the fourth truth, and we can box it in. We can box that coronavirus in if we know that where the coronaviruses are, and in those places where the coronaviruses are, we can get people to social distance. Here's the truth I was talking about yesterday. We got to find a balance between being too afraid and causing too much death. You know, the economy doesn't have to come to a halt. People don't have to be on unemployment and not be able to eat. People's businesses and people's jobs don't have to disappear. But at the same time, we want to protect people from dying, and there has to be a balance. And right now, I see in America, there's one extreme or the other, which is let's open up the economy and get tattoos and go bowling, or let's all stay in our apartment and do nothing. And there has to be some sort of balance between the two, to finding that balance so that we all don't starve to death, that our businesses, if you're a business owner or your job is there, that you can feed your family, but at the same time, be careful. That balance, certainly in the United States, has not been met yet. We have to protect our nurses and doctors, the frontline heroes. They are essential. If they are sick, they die. Who's going to take care of us? So when you hear in the news that doctors and nurses do not have essential protective equipment, that is a problem. Because if we don't have doctors and nurses and they all get sick or, God forbid, die, we have nobody to take care of us. We also have to protect, here's the truth, we got to protect the most vulnerable people in the United States. 8 out of 10 deaths are people over 65. And include people with weak immune systems and underlying conditions such as asthma, heart disease, high blood pressure, diabetes, just like we spoke about over the last few weeks. There has to be a way that we can protect those most vulnerable, yet we all don't sit in our apartment. There has to be a balance, and somebody in our government has to be smart enough to be able to strike that balance. The government needs to work. Here's the truth. The government needs to work with the private sector. They talk about getting a vaccine. That would be beautiful if we get a vaccine. I don't believe, based on everything I read, they will have a vaccine this year or maybe even next year. the fastest that a vaccine has ever been made from start to mass vaccination of a population is over a decade. That's the fastest it's ever been in the history of the world. Yet they're talking about vaccinating people at the end of the year. I don't believe on a mass scale they will have a safe and a workable vaccine that actually works by the end of the year. What they may have, and I hope, is treatments. It's much quicker to get a treatment than it is to get a vaccine. So God forbid you get infected with coronavirus, you can take a pill or multiple pills and not have to be hospitalized. And of course, we have to not neglect non-coronavirus issues. Everybody's talking about coronavirus, but people are still dying of cancer and heart disease and accidents and everything else, and elective procedures, people who need knee surgery and finger surgery and all sorts of elective procedures. They need to be able to get those. And finally, when this is all over, we better not freaking forget this. We better not freaking forget this. To ever go through this again would be a disaster. So we better be prepared next time. Now, according to the AP, which is the Associated Press, the CDC had come up with a document titled Guidance for Implementing the Opening Up of America Again Framework. And it was researched and written to help faith leaders, business owners, educators, state and local officials as they begin to reopen the economy, yet not get people sick. It was supposed to be published this past Friday. It was made up not of politicians, but of scientists who are using the best information that we have right now to guide states and local authorities on how to open up and strike that balance without making everybody ill. Well, Donald Trump didn't like it. And why doesn't he like it? Because if the economy does not get roaring again very soon, and there's not a person in the world who thinks it will, no matter what Donald Trump says, he is not looking at getting reelected again. I saw Joe Biden has at least a 7 to 9 point lead over him right now. And he's just been sitting in his basement, not saying anything. He's just letting Trump stick his foot in his mouth and go down with the sinking ship. Because in the history of the United States of America, there's been no president who gets elected for a second term during a recession or let alone a depression. And as Bill Clinton, who's one of the best politicians, you may not like him, but great politician, once said, it's the economy, stupid, nothing else. And right now, our economy is down the tubes. And we could blame coronavirus. Yes, coronavirus caused this. But we could also blame our leaders for allowing coronavirus to cause this. So we'll talk about that in a little bit. Now, this is a little strange, what we learned today about people where they were catching coronavirus. New York Governor Andrew Cuomo shared an initial survey results of hospitalized coronavirus patients during a press conference yesterday. He said 66% of respondents were at home before they were admitted to the hospital with coronavirus. So you say 2 out of 3 people are catching coronavirus in their own home. How does that jive with the fact that Governor Cuomo and just about every responsible politician is telling people the best way to avoid getting coronavirus is stay at home? If the coronavirus is in your home, why are you staying at home, or how are you catching it in your home? It's gone unexplained. We don't know why 2 out of 3 people who are being hospitalized in New York City are catching coronavirus in their own home. And yet we're told to stay in our home to avoid catching coronavirus. 1,200 patients were surveyed, and they were surveyed from 113 different hospitals, not only in New York City, but in the entire state of New York. The survey found that, which we know already, it was disproportionately affecting African Americans, people of color, and Hispanics. It's unique, this survey, because it's the first survey to release where patients were coming from, where they were catching coronavirus. My sister called me to tell you the truth, and we were talking about this. She said, did you see that? She said, it was very interesting. What do you think of this? And at first you say, well, we know coronavirus is hitting the minority communities more. Certainly the fact that coronavirus is hitting our minorities more than in the upper middle class socioeconomic groups of people, which are predominantly non-minority, but there are minorities in the upper social classes as well. That puts a magnifying glass not so much on coronavirus, but certainly on the disproportionate, effects of a virus on people. And why is it disproportionately affecting one group over the other? Certainly, there's nothing in somebody's DNA and somebody who's a minority that coronavirus cause, more infections because of somebody's skin color. That would make no sense whatsoever. So it puts a magnifying glass on what's going on. Is it, and I told my sister, I don't have the answer. I really don't. I don't know. I can take guesses. I think, people maybe are living in closer quarters. They're living multi-generation. So you have family members coming in and out of a home, perhaps. Perhaps people are just not telling the truth. They went to the CVS and came back and got sick, and they're not using protective gear. I don't know the answer. Christy Consali says maybe it's passing through the vents of people's home. That's also possible. I think it's about the density of the populations, and I think it's also, maybe more than that person who caught it doesn't live alone in that apartment. I live in my apartment with my daughter. It's just me and my daughter. I watch her very carefully on where she goes, but maybe other people have more people in their apartment living. I don't know. And maybe people are going and coming, but it's certainly a magnifying glass on inequality in America. And it's inequality not on people's health. It's inequality based on people's living standards. It's inequality based on people's nutrition and whether they have access to okay or good medical care. So I think coronavirus, unfortunately, is a magnifying glass on the greater inequality of what's going on here in America. I don't have the answer for you, but I find it very strange why, if they say stay at home, yet you getting sick at home. Meanwhile, Governor Cuomo, some good news. He is preventing any eviction in the state of New York now until August 20th. So anybody who cannot pay their rent cannot be taken to court. There's a moratorium, cannot be taken to court to get evicted from their home, at least until August 20th. Now, that is not rent relief. That is rent delay, meaning that Governor Cuomo is not saying you can't pay your rent and you'll never owe it. What he's saying is you have until August 20th to figure out how to pay your rent before I'm going to allow a landlord to throw you out of your home. Now, Cuomo said late payment fees also will not be allowed, and renters can also ask their landlord to use their security deposit to pay rent. These are all now laws. So if you have a security deposit with your landlord, you can call them up and say, put that towards May and June or towards May. And you cannot have a landlord charge you fees for late payments. Unfortunately, you'll have to eventually pay it, but hopefully you will be able to pay it at some point. Now, this is also very interesting. We always get new interesting news about coronavirus every day. Research has revealed that New York City's coronavirus outbreak grew so large by early March that it was actually people from New York City that left New York City and traveled around the United States of America that was the cause of a majority of infections in the United States. And we already know that people brought coronavirus not from China, because Trump keeps saying, I shut down China, but it came from the Europeans who were coming into JFK and Newark Airport, because that is a gateway from Europe to come to the United States of America. It was Europeans who came into JFK and Newark who helped spread coronavirus throughout New York City. And then it was people who live in New York City who traveled elsewhere, or a lot of times travelers, tourists who came into New York City, caught coronavirus, and then went back home. This all happened in March when Donald Trump said it's a flu, we got nothing to worry about. And this actually, the city joins other densely populated urban hotspots around the world. It started with Wuhan, China, and then Milan. So it was densely populated areas where multiple people got sick very fast, left those densely populated areas, and then spread it around. Now, they say in New York at the end of February, thousands of infected people packed trains and restaurants and went to tourist attractions. And they passed through not only Newark and JFK, but LaGuardia as well. And during this crucial week in March, New York's political leaders waited to take aggressive action. They didn't do anything about it. And by mid-March, when Donald Trump restricted travel from Europe, it was absolutely pointless at that point, the data suggests, because the disease was already here in New York. It was spreading wildly, not only in New York City, but around the country. Donald Trump was about 30 days too late from restricting travel from Europe. Acting earlier would have blunted the virus's march across the country during the month of March. Now, Christian Anderson, a professor in the Department of Immunology and Microbiology at Scripps Research, this is what she had to say about this. She says it means we missed the boat early on, and the vast majority in this country is coming from domestic spread. I keep hearing that it's somebody else's fault. That's not true. It's not somebody else's fault. It's our own fault. It's the fault of our politicians. So when Donald Trump says he did it, he didn't. He stopped the virus coming in from Wuhan. He needed to stop it from Europe in the end of January. And obviously, there was no testing. And obviously, there was a lot of fake news coming from the White House about the true extent of the outbreak. They knew about it in January. And you want to know why we know they knew it about in January? Because very powerful senators and very powerful politicians were selling stocks in businesses that they knew were going to tank once coronavirus went rampant. They knew about it in January. They did nothing about it. He put a stop on China. He needed to do a lot more. And so what they did, in my opinion, was just not enough. Now, Danny Lever, the communications director for Governor Cuomo, criticized federal authorities, describing an enormous failure by the federal government to leave New York and the East Coast exposed to flights from Europe, while at the same time instilling a false sense of security by telling the state of New York that we had no coronavirus cases all the way through the month of February, when they damn well knew that was not the case. Meanwhile, this is an immigration show. It's not a coronavirus show. We do got to talk a little bit about immigration. I don't talk enough about this, so I'm going to talk about it right now. The Visa Bulletin. We get these questions all the time. What is this Visa Bulletin, and what am I supposed to be looking at? Well, the Visa Bulletin is given out by the Department of State. You can actually Google Visa Bulletin, Department of State. You can look it up yourself. It's the first thing that pops up when you Google it. They give a list, and the list tells you when you will be eligible for a green card once you have your approved visa petition. So people always call me all the time and they say, Brad, I filed my I-130. It's 5 years. I'm concerned. And I tell them, don't be concerned, because your priority date, your date on the waiting list, is the date in which your application was filed. So when your I-130 is filed, that's your date on the priority date list. And no matter whether it takes the I-130, for example, 30 days, 60 days, 90 days, 900 days, or in many cases, 5 years, you're going to get your green card on the same exact day, because your place on the waiting list, you get slotted in based on where your priority date is. So, and for example, if you filed your I-130 on January 1st, 2015, that's your priority date. Whether they approve your case in 2017, 2019, or 2020, your priority date is January 1st, 2015. And then you look at the visa waiting list is at travel.state.gov/visa bulletin, and you look to see where they are. So for example, for May, we're looking at May right now. the employment-based. Lee, if you can go back and show us priority dates for the family-based, those are the ones that start with F. And in the category for employment-based, for family-based, we're not looking at that right now, but that's what I am talking about. Dates for filing family-sponsored visa applications. That's what we're looking at. And the F1 category, as you see, all chargeability areas, it says F1 category, November 22nd, 2014. The F1 category is the category for unmarried sons and daughters of U.S. citizens. And they have a date there that says November 22nd, 2014. That means people who filed their I-130 visa petitions for their unmarried children on November 22nd, 2014. Those unmarried children over the age of 21 are now eligible for their green cards, no matter how long it took the I-130 to get approved. As long as that I-130 was approved and you filed before November 22nd, 2014, your kid's eligible for a green card today. Except, obviously, we got that ban, which is a whole other story. In China, they're also November 22nd, 2014. In India, it's also November 22nd, 2014, but Mexico and the Philippines have much longer waits. If you look at the F2A category, they're up to March 1st, 2020. Wow. March 1st, 2020. Who is in the F2A category? The F2A category are spouses of permanent residents and children under 21 of permanent residents. What does that mean? That means that if you are married to a permanent resident, your wait for a green card, assuming you have an I-130 approved, your wait for a green card is current. Current. So that means there is no wait for a green card, which means that you are in the same position as if you're married to a U.S. citizen, eligible for a green card immediately. For the F2B category, they're up to January 15th, 2015. Those are unmarried children of permanent residents. For married children, they're March 15th, 2008. That's why I always say if you're married, you're going to wait 10, 12 years for a green card. You're better off make sure your kids don't marry. And for brothers and sisters, we're going to wait donkey years. Everyone knows what donkey years is. And they're only up to July 22nd, 2006. Tomorrow, we will talk about the employment-based visa categories. Thanks for watching. For more Bradshaw Live, like and subscribe to our YouTube channel.